What's up, you guys? Welcome back to our channel. It is Jade and Lila here, coming at you with a nursing school related video. Today I just want to talk about a couple test taking strategies that I have implemented throughout nursing school, and these are the things that have helped me pass my exams. So I hope that some of these help you guys, and I hope you guys can implement them into your test taking strategies. So thank you guys so much for watching and being here. I hope you guys subscribe to my channel if you haven't already, and let's just go ahead and jump on into the video. So number one, this is the tip that has helped me the most throughout nursing school, and that is to cover up my answers and just solely read the question. And then I restate it in my head in my own words. So I'll read it, kind of identify keywords, and really think about what is this question asking me. And I try and think of an answer in my head without looking at the answers first. Because majority of the time, if I have an answer in my head and then I uncover the answers and my answer's there, I'll pick that one because I initially already have that answer in my head, and then majority of the time it's correct. So that's my number one tip for you guys. Cover up the answers, solely just read the question and then reveal the answers and kind of read the answers throughout. But that is number one. Number two is look for keywords in the question and the answers. So by keywords, I mean, like in the question, if the words first, initial, best, these words are keywords that the question's asking you, what are you gonna do first? What is the most important intervention that you need to complete first? Everything else can wait, but this needs to be done now. So always look for keywords. That will really give you an indication of what the question's asking and give you a good idea of what the correct answer will be. Number three, I always cross out the answers that I know are incorrect. I get those out of the way, and majority of the time I'm left with two, and that's where number four comes in. When you get down to two answers, usually you think both of them are correct and you have a hard time figuring out which one's right, but usually that's when I go back, I read the question over again, I look for those keywords again, and I look for the same words in the answer. Because if you see the same words in the question and the answer, usually that answer is correct. So number five, never change your answers. As soon as you circle in and bubble in your answer, do not go back and change it. I have learned this the hard way. I always manage to go back and change my answers, and lo and behold, I had it right the first time. So I never, very rarely will I go back and change my answers unless I have a real reasonable reason to change my answer. I will not touch it because majority of the time I'll just piss myself off because I had it right the first time. So never ever change your answers. Number six, if you're having a hard time answering this question, go back to the basics, like ADPI, your nursing assessment, or your ABCs. So ADPI is your assessment, diagnosis, planning, implementation, evaluation. So if you're stuck on an answer, or you're stuck between two answers, go back to the basics. What's the question asking you, and can you use your nursing assessment, ADPI, to answer the question? Or your ABCs, you know, airway, breathing, circulation. Which one, airway, is most important? So if the question's asking you, what do you do first? And one of the questions is give oxygen. Number seven, get a good night's sleep, eat a good breakfast, and just do not study at all the day of, because by then anything you try and study just then and there, it's gonna go right over your head. So number eight, use a highlighter. I always use a highlighter when I'm taking my exams, and I use this to highlight my keywords. So the first, initial, best, and then whatever the disease process is. So if they're mentioning diabetes mellitus, I'll highlight that. If they mention that it's a female or male, how old they are, their risk factors, those are the things that I highlight, because a lot of the times those will play a huge part in how you answer your question. So those are my test taking strategies for you guys. I hope that some of these can help you guys in the long run. These are the things that have really helped me out. I really struggled my second semester with taking nursing exams, and these are the things that had helped me. So I hope they help you, and thank you guys so much for watching. I hope you guys enjoyed. If you have any nursing school related video recommendations, please leave them down below in the comments, and I'd be happy to make them for you. Thank you so much for watching, and I will see you guys in my next video. Bye!